So again, every scientist gets into science for a reason. And for me, it was really learning about when my grandmother died of breast cancer. I've spent most of my career, the last 30 years, in the oncology space. And so the ability to generate patient-derived organoids, I think, is really exciting. So we could tailor treatments to specific tumors. And that way we don't have to have patients go through all of these ineffective treatments just to find the correct one. So we can start tailoring treatments right away. And I think by far, to me, personally and professionally, that's probably the most exciting aspect of 3D cultures that I see down the road.
It's just a huge propensity of research that's gone into 3D investigation, around oncology models, around neuro-oncology, things like that, where the physician scientists are now working very closely with the benchtop scientists to develop tumor profiling and precision oncology initiatives that, when combined with the whole omics era that we're in, will now have really a complementary set of information that, if you put machine learning and AI on top of that, I think we'll see very soon that physicians are enabled with information that they could take to their patients and use in an efficacious way, not just with current therapies, but also with new discoveries, novel therapies.
I've really been surprised at how far these organoids can go, especially when they're given a conducive microenvironment. I've been amazed at their ability to recapitulate phenotypes that are very complex and that we thought would involve a whole host of factors, such as polycystic kidney disease. And we can see the disease in the dish, and it's quite remarkable. And this is teaching us new things about how these diseases work and what is necessary, what is sufficient, and how can we treat them. So I've been very impressed, and there's a lot of work going on in other groups as well, where we can see the organoids getting more mature. We see organoids growing hair. We see organoids that look like pieces of the ear, and this is quite remarkable that they can go as far as they can, even outside of a living organism.
Yeah, so some of the more exciting advances I've seen in 3D and organoid work lately is around personalized medicine approach. Generating these libraries for looking at individual patients' response to drugs just blows my mind. I just think it's so amazing how well organoids can recapitulate the biology from an individual.
I think one of the really cool ones to me is microfluidics, so working with different microfluidics devices in order to try and create a more complex 3D model using organoids. It's definitely very difficult to completely recreate biology in a dish, but we're getting closer.
I think one of the things that we've seen is the FDA's acceptance of 3D models as a potential replacement for animal models. I think that's a very important step forward, because if you could imagine, animal models are certainly time-consuming, and of course harming animals is an essential part of working with animals. But I think with the development that we've seen in use of organoid models for tissues and organs, I think that's going to be a very big step forward in pushing some of these therapeutics into market.